Let's shed some light on diverticulitis, a condition affecting the digestive system. Imagine small pouches forming in the lining of your digestive tract, particularly the large intestine. These pouches are called diverticula. Most of the time, they exist peacefully without causing any trouble. This is known as diverticulosis. However, sometimes these pouches can become inflamed or infected. This is when diverticulosis progresses to diverticulitis. Think of it like a small cut on your finger getting infected. The inflammation causes a range of uncomfortable symptoms. While the exact cause of diverticula formation remains unclear, diet plays a significant role. A diet low in fiber is believed to be a contributing factor. When there's not enough fiber in your diet, your colon has to work harder to push waste through, putting pressure on the intestinal walls, which can lead to the formation of these pouches. Diverticulitis can manifest as a spectrum of symptoms, ranging from mild to severe. The most common symptom is pain, often localized to the lower left side of the abdomen. This pain can be persistent and may worsen after eating. Other symptoms can include a change in your bowel habits, such as diarrhea or constipation. You might also experience bloating, nausea, and vomiting. Some individuals with diverticulitis develop a fever, indicating an infection. It's important to remember that not everyone with diverticula will experience symptoms. Many people remain unaware of their condition until it progresses to diverticulitis and symptoms become bothersome. While diverticulitis can affect people of all ages, it's more prevalent as we get older. The risk significantly increases after the age of 40. This is likely because as we age, the walls of our colon naturally weaken, making them more susceptible to developing these pouches. Think of it like a garden hose that becomes more prone to developing weak spots and bulges over time. However, it's not just about age. Other risk factors can contribute to the development of diverticulitis. These include constipation, a family history of the condition, obesity, smoking, lack of physical activity, and certain medications such as opioids leading to constipation problems. If you experience sudden severe abdominal pain, especially in the lower left side, don't hesitate to seek medical attention. This could indicate a serious case of diverticulitis that requires immediate treatment. Other red flags include a high fever, chills, rectal bleeding, persistent vomiting, and inability to pass gas or stool. These symptoms should never be ignored. Remember, early diagnosis and treatment are crucial in managing diverticulitis and preventing complications. Your doctor can diagnose the condition through a physical exam, medical history review, and tests such as a CT scan or colonoscopy. Conservative care first line of defense. For mild cases of diverticulitis, conservative treatment is often sufficient. This typically involves a combination of rest, dietary modifications, and antibiotics. Your doctor might recommend laxatives and a diet full of fibers to help you to keep your stool smooth and soft. Also, they might recommend a natural bulk-forming laxative called psyllium or ispagula to help relieve constipation and irritable bowel. In case of fever and signs of severe infection, antibiotics help combat infection and reduce inflammation in the affected pouches. It's essential to complete the entire course of antibiotics as prescribed, even if you start feeling better before finishing them. Lifestyle changes. Navigating life with diverticulitis. Once the initial inflammation subsides, making long-term lifestyle changes can help prevent future episodes of diverticulitis. The cornerstone of this approach is adopting a high-fiber diet. Fiber adds bulk to your stool, making it easier to pass and reducing pressure on your colon. Aim to incorporate plenty of fruits, vegetables, whole grains, and legumes into your diet. These foods act like a broom, sweeping through your digestive tract and promoting regularity. In addition to dietary changes, regular exercise can work wonders for your digestive health. Physical activity helps regulate bowel movements and reduces the risk of constipation, a common trigger for diverticulitis flare-ups. Surgical intervention. When is it necessary? While most cases of diverticulitis can be managed effectively with conservative treatment and lifestyle modifications, surgery might be necessary in certain situations. For instance, if you experience recurrent episodes of diverticulitis despite lifestyle changes, your doctor might recommend surgery to remove the affected portion of your colon. Surgery is also indicated if you develop complications such as a perforation, abscess, or fistula. The good news is that advancements in surgical techniques have made the procedure less invasive. Laparoscopic surgery, which involves smaller incisions and the use of a camera, is now commonly performed, leading to faster recovery times and reduced post-operative discomfort. Life after surgery, precautions and recovery. After surgery for diverticulitis, your medical team will provide specific instructions to aid your recovery. This typically includes gradually reintroducing solid foods into your diet, starting with low-fiber options. Your doctor will also advise you on activities to avoid during the initial recovery period, such as heavy lifting and strenuous exercise. These activities can put undue stress on your abdomen and hinder healing. It's crucial to attend all follow-up appointments with your doctor to monitor your progress and address any concerns. They will assess your healing, adjust medications if needed, and guide you on resuming normal activities. Early detection, better outcomes. Your health matters. Diverticulitis is a common condition that becomes more prevalent with age. While it can cause discomfort and disrupt daily life, understanding the symptoms, seeking timely medical attention, and adopting a proactive approach to management can significantly improve outcomes. Remember, early detection is key. If you experience persistent abdominal pain, changes in bowel habits, or other concerning symptoms, don't hesitate to reach out to your healthcare provider. By working together, you can effectively manage diverticulitis and live a full and comfortable life.